widely held idea that abortion is actually better for women than childbirth. But the research that our organization does wants to challenge that assumption. Because if you actually look at what's published in the medical literature, you will find that the medical literature does not support that idea. I'm going to talk very briefly about a number of things that happen to women after abortion. We're going to talk about immediate things that happen after abortion, and we're going to talk about long-term consequences. And then I'll turn it over to my other two speakers. After any surgery, you have risks of bleeding, infection, and damage to the organ that's being worked on or the organs that are nearby. Well, what is the risk for abortion? There are very few studies, and especially difficult to do any studies here in the United States. But in countries where the medical record is owned, it is fairly easy to do such studies, and this is one such study. This is a comparison of medical versus surgical termination of pregnancy that was published, I believe, in 2009. By using all the women in Finland who had abortions from 2000 to 2006, because their medical record is owned. So when they have a complication, it shows up on their medical record. Unlike here, when a woman who has an abortion has a complication, she's told, go to the ER, and by the way, don't tell them you had an abortion. So there's really, really difficult to track in this country the consequences, the immediate consequences from abortion. What they found was that with women who had a medical abortion, about 15% had hemorrhage after the medical abortion. That was a physician-defined hemorrhage, not just I bled a lot, but actually a physician looking at the woman saying, this woman hemorrhaged, versus 2.1% of surgical patients. 6.7% of medical patients, so that's a little more than 1 out of 20, it's about 1 out of 15, had an incomplete abortion with tissue left inside, versus 1.6% of surgical abortions. About 6% of medical abortions had to have a surgery anyway, even despite having the medical abortion, versus about 2% of surgical. And operative injuries, that's where the woman was actually injured because of the emergency surgery, was a little bit higher for medical than surgical, but not very high. But what the author said is because medical abortion is being used increasingly in several countries, it's likely to result in an elevated incidence of overall morbidity. Morbidity is problems. It's a problem caused by the procedure itself, of overall morbidity related to the termination of pregnancy. So in the first trimester, medical abortions with mifepristone and misoprostol result in 20 out of every 100 women with a significant adverse event, 15 out of every 100 women hemorrhaging, 7 out of every 100 women with tissue left inside, and 6 out of every 100 women needing surgery. In the second trimester, it's 40 out of every 100 women. Well, what are the long-term adverse consequences? We're going to look at 3 of them. There are a number, and I limited it to 3. We're going to look first at preterm birth, then breast cancer, then suicide and depression. Preterm birth is a very interesting phenomenon. This is from the Institute of Medicine, which is a very reputable organization that reviews big topics, big problems in medicine, and generally does a very good job. And what they say is this: the rate of preterm birth in the United States is a growing public health problem that has significant consequences for families and costs society at least $26 billion a year. Preterm births are defined as occurring before 37 weeks of gestation, and they now account for 12.5%. More than 1 in 10 births in the U.S. is preterm. This is a 30% increase since 1981. And they go through the possible risk factors, mutable risk factors. These are risk factors that you can change. Inadequate prenatal care, cigarette smoking, drug use, cocaine, alcohol, caffeine, dietary intake. Are there some foods that are associated with this? Sexual activity in late pregnancy. Are some women, are runners more susceptible? They looked at all of these different risk factors. And what they found was they couldn't account for a lot of preterm birth. But when you dig into what's actually in that report, it's very interesting. What you have, if I can get my thing to work here, this black line is a conglomerate of all races put together. Okay? This dashed line is preterm birth in Caucasians, and this red line is preterm birth in African Americans. Why the discrepancy? Well, it turns out it's not just 1 year. That was 1 year's data. This is from 1992 through 2003. The source of this information is from the Center for Disease Control. And what you find is that Caucasian women are here in the yellow. African American women are hugely overrepresented in this preterm birth population. Why is that? Well, findings related to socioeconomic status, that's SES, suggest that the disparities in the rate of preterm birth between African American and white women persist after attempts to adjust for socioeconomic differences. Other behavioral differences have been evaluated as potential causes, but proportionally fewer African American women smoke, and the rate of use of drugs and alcohol is no higher than white women's. So why is this? Well, and this is continuing in the IOM report. In sum, significant racial ethnic disparities in preterm birth exists in the United States. Racial differences in socioeconomic condition, maternal behavior, stress, infection, genetics cannot account for the disparity. More research is needed. It's always needed. And what they say is here, there's been only modest success in accurately identifying women at risk. And now I'm in the box. Unfortunately, many of the better established and more predictive risk factors are either immutable, that is unchangeable, in the current pregnancy, or because of our present state of knowledge, pose significant challenges. And they list these immutable, unchangeable risk factors in Table B5. And what you find is number 3, prior first trimester induced abortion. This is the only place in the entire 50-plus page report that induced abortion is mentioned, yet it is the single most common surgical procedure in the country. So if you look at the first 2, previous low birth weight, well, if you have an induced abortion, you have previous low birth weight babies. Multiple second trimester spontaneous abortion. If you have a first trimester induced abortion, you get a second trimester spontaneous abortion. It's much more common. So all the first 3 actually relate back to first trimester induced abortions, yet this is the only place in the report that they put it. Now, let's think about this a minute. There's some other interesting data. The CDC abortion surveillance available in 2006 looks at statistics related to abortion. And what they said was the abortion ratio for black women was 3 times the ratio for white women, so I'm right. I'm right here. And then the abortion rate for black women was 2.9, almost 3 times the rate for white women. And this is the table that they reported in, and I broke out the 2 things in the box. The red boxes are what I have here. If you look at the proportion, the abortion ratio for white women versus black women, and the abortion rate for white women versus black women. Well, it's very interesting that the IOM report establishes the fact that African American women have triple the rate of very preterm birth, that is, birth less than 32 weeks, the kind of babies that stay in the hospital on the incubator, compared to Caucasian women. Socioeconomic status and behavioral factors do not account for this difference. And according to the CDC, African American women per capita have triple the rate of induced abortion as compared with Caucasian women. Very interesting. How long has this been known? It's been known for a very long time. This is a paper from 2003. It's a CME review article, and I will quote, "Preterm birth is a common problem affecting around 10% of deliveries in the Western world. It is the leading cause of infant morbidity and mortality. Despite substantial investigative effort, primary preventative measures to lower rate of preterm births have proven futile, and rates have been steady or increasing over the past 2 decades. The population-based studies contained in our table suggest that induced abortion increases the risk of preterm birth and subsequent pregnancies." That's in the United States. In light of these data, we believe that women considering abortion should be informed that the procedure may increase the likelihood of subsequent preterm births. I wonder how many women are actually informed of that. It's not just this country. This was a huge meta-analysis done back in 2009. And their conclusions were a previous ITOP, that's induced termination of pregnancy, is associated with a significantly increased risk of low birth weight and preterm birth, but not small for gestational age. The risk increased as the number of induced terminations of pregnancy increased. Here's another very interesting study breaking out the kind of preterm birth that happens. This paper focuses on the risk of early premature births, less than 32 weeks, and extremely early premature birth, less than 28 weeks. Women who had 4 or more induced abortions experienced on average 9 times the risk of extremely preterm birth, an increase of 800%. These results suggest that women contemplating induced abortion should be informed of this potential risk. It's been claimed that induced abortion is directly responsible for many thousands of cases of cerebral palsy in the United States, in North America alone, that otherwise would not have occurred. Supporting this assertion is the fact that the cerebral palsy risk in extremely preterm birth is 38 times higher than in the overall population of newborns. As the liability costs for cerebral palsy are exceptionally high, induced abortion, without detailed informed consent, may carry an unsupportable legal liability. This is a huge study from Europe where abortion is legal and tracked on the medical record. 17 countries, they concluded that the risk of very preterm birth, that is 22 to 32 weeks, increased by 50% after one abortion and by 80% after two. Previous induced abortions were significantly associated with preterm delivery, and the risk of preterm birth increased with the number of abortions. In fact, there are 120 studies in the medical literature that support this causal association. There are 0 studies that have shown a benefit from induced abortion in relationship to preterm birth. Now, this is a very interesting natural experiment. Poland was part of the Soviet Union. They had rampant abortion, more abortions than births. But, as you know, the Soviet Union fell, and between 1989 and 1993, Poland's induced abortion rate decreased 98% due to a restrictive abortion law. What do you think happened to the preterm birth rate? The Demographic Yearbook of Poland reports that between 1995 and 1997, the rate of extremely preterm births dropped by 21%, the only place in the world where preterm birth rate has dropped. All right, we're going to shift a little bit and talk about abortion and breast cancer. And I've chosen a paper here that actually didn't look directly at abortion. What they looked at was the incidence of breast cancer in relationship to pregnancies that ended early, less than 32 weeks. And I want to read you this discussion because this is one of the best discussions that I've heard. Pregnancy, and especially first pregnancy, appears to represent a critical window in determining future breast cancer risk. The occurrence of a first completed pregnancy and the age at first pregnancy are among the strongest known predictors of breast cancer risk. Early first pregnancy carries a transient 3 to 4 year increase in breast cancer risk, but very few women get breast cancer in their 20s, and a long-term reduction in risk. The transient elevation in risk is thought to be due to extensive proliferation of breast tissue that occurs in response to high gestational hormone levels. Let me unpack that for you. What happens between a woman who's never been pregnant and a woman who's had a child and breastfed is that the breast tissue itself changes. There's a part of the breast that makes milk, and those cells rapidly divide and grow in the first pregnancy. And they grow under the influence of a hormone called estrogen. When you hit about 32, 33 weeks, there is a change in that those breast cells which are not capable of producing milk become capable of producing milk, and that's because of a change in the hormone level in the body. So if you have a miscarriage at 22 weeks, you may not make any milk afterward, whereas if you have a preterm birth at 32 weeks, you will make milk. So what happens to change it? Well, it turns out if you arrest the breast in that stage where the tissue is rapidly proliferating, rapidly growing, and then it never matures to making milk, that stage that the breast tissue is arrested in is very susceptible to other carcinogens. So it's what we call the two-hit theory. So you arrest the breast in a susceptible state, and then you never mature it. And that's what's going on here. Okay. In their discussion, they say, and I'm going to start right here, in a recent large cohort study of Danish women, again, it's easier to do medical records in Europe because the state owns your record. Melby found an increase in breast cancer risk among women who had delivered before 32 weeks gestation, whether it was abortion or whether it was another kind of emergent delivery. Mammary cells are thought to proliferate during the first and second trimester of pregnancy and to differentiate in the third. Extreme prematurity is characterized by high maternal estrogen, which increases breast cell proliferation. Increased breast hyperplasia followed by the termination of pregnancy prior to full differentiation, that is, fully grown and capable of producing milk, may increase the breast susceptibility. Extreme prematurity, that is less than 32 weeks in a woman's first pregnancy, was associated with a more than twofold elevation in risk, that's in this study, after adjustment for demographic characteristics. Okay. Now, this is a terrible slide, and I'll tell you why. Because I had to go into the really fine print underneath a table to find this mentioned in the study. But what they say is, and I'm going to go over here on the side, in Table 3, separate analyses were presented for induced and spontaneous termination. A significant elevation of risk was associated with a history of induced abortion, but not spontaneous abortion. An odds ratio of 4.0, that is four-fold increased risk, was associated with a history of repeated interrupted pregnancies with no intervening live births. Now, this is another very interesting study. This is from Janet Dalling, National Cancer Institute. And look, 1994, we've known this for a very long time. What she said was this: certain events in reproductive life, especially completed pregnancies, have been found to influence a woman's risk of breast cancer. We conducted a case-control study of breast cancer in young women, that is, women that were premenopausal, born recently enough so that some or most of their reproductive years were after the legalization of abortion. Well, what they found was that there was an increased risk of breast cancer in women who aborted. While this increased risk did not vary by the number of abortions or by the history of a completed pregnancy, it did vary according to the age at which the abortion occurred and the duration of the pregnancy. Highest risks were observed when the abortion was done at ages younger than 18, particularly if it took place after 8 weeks gestation. That's because the hormone levels surge after 8 weeks gestation. Or at 30 years of age or older. The reason for that is it's likely to be the last pregnancy, so there isn't another chance for the maturation of the breast tissue that proliferated in that pregnancy. No increased risk of breast cancer was associated with a spontaneous abortion. Well, it turns out there is a small increased risk, but not much, not compared to an induced abortion. Among women who had been pregnant at least once, the risk of breast cancer in those who had experienced an induced abortion was 50% higher than among other women by age 45. Teenagers under age 18 and women over 29 who procure an abortion increased their breast cancer risk by more than 100% by age 45. This is premenopausal breast cancer. And teenagers with a family history of breast cancer who procure an abortion face a risk of breast cancer that is incalculably high. All 12 women in this study with this history were diagnosed with breast cancer by the age of 45. Now, this is not all abortion, and this is not all breast cancer, but it is the subset of those young women who abort their first pregnancy, delay a term pregnancy, and especially in women like that who have a family history. Supporting this was a recent study by a European Breast Cancer Research Institute out of France. This is the French National cohort study. Almost 1,000 women. They looked at mutations in a certain place in the gene code that codes for breast cancer. And they found this: our results confirm the existence of a protective effect of an increasing number of full-term pregnancies toward breast cancer among those who have these mutations. It's BRCA1 and BRCA2 mutation. Additionally, hazard ratio showed an association between incomplete pregnancies, that's a euphemism for abortions, and a higher breast cancer risk, which reached 2.39, which is twice, you're doubling your risk among women who had at least 3 incomplete pregnancies when compared with women with 0 incomplete pregnancies. This increased risk appears to be restricted to incomplete pregnancies occurring before the first full-term pregnancy. And I'm going to briefly cover this just as an introduction to our next 2 speakers. In 1997, a very important paper came out by Micah Gisler, Pregnancy-Associated Deaths in Finland. They looked at 9,000 women, and they did a retrospective record review of all the death certificates for women of reproductive age in that time that died between 1987 and 1994. And what they found was in the chart. The numbers here on the side are unit numbers, so 1, 2, 3, 4, it's units. No pregnancy, that was the baseline. That's what they compared it to. Birth conveyed a protective effect. Miscarriage was higher by about 50%, but abortion was significantly higher. The risk of suicide following a birth was about half that of the general population, and that finding was consistent with previous studies that have shown that an undisturbed pregnancy actually decreases the risk of suicide. Abortion carried a 6-fold higher risk of suicide compared with birth. Now, this is from the study. Interview-based studies have consistently shown extraordinarily high levels of suicidal ideation, 30 to 55%, and reports of suicide attempts, 7 to 30% of women, among women who have had an abortion. In many of these studies, the women interviewed explicitly described the abortion as the cause of their suicidal impulse. Now, I was a little skeptical when I first heard that data, but this is the chart that convinced me, because I've worked in OB-GYN long enough and I've had enough experience with grieving women to understand how that works. And this is exactly what you would expect. This is suicides per 100,000 women. This is months after the pregnancy outcome. So this is 1 to 2 months after a birth, after a miscarriage, or after an abortion. So immediately after, you have the immediate regret, which goes away until when? Until when the baby would have been born. So here, this is for birth, this is for miscarriage, and most of them would have occurred in like the second month or so, and this is abortion. This graph is exactly what you would expect if women were having a complicated grief reaction from their abortion. What they say is, our data may underestimate the number of suicides associated with pregnancy. We use the official cause of death to define suicide. Apart from the 73 pregnancy-associated suicides, there were also 26 pregnancy-associated deaths with an unclear cause, 10 violent and 16 nonviolent, and 55 accidents. Some of these 81 causes might have actually been suicide. This was confirmed by a pro-choice researcher from Christchurch, New Zealand, David Ferguson, and he reports this. This is the study was done as a part of a huge survey in New Zealand called the Christchurch Health and Development Study. It's a 25-year study of a birth cohort, so there's no question of recall bias here. About 506 to 520 women, depending on the year at which they were surveyed. These are his results. Those having an abortion had elevated rates of subsequent mental health problems, including depression, anxiety, suicidal behavior, and substance use disorders. This association persisted after you adjust for other things like, were they mentally ill before they came in? And the conclusions were, the findings suggest that abortion in young women may be associated with increased risks of mental health problems. This is not an isolated finding. In 2011, Dr. Priscilla Coleman reviewed the medical literature, the psychiatric literature, and she looked at, was there an association in any of these papers between abortion and subsequent mental health outcomes? She had a very strict inclusion criteria. This is what's called a meta-analysis. This line here means that in the study, this line in the middle, if a study falls here, it means there was no difference seen between abortion or birth. Okay, that's the comparison, abortion versus birth. If there was a benefit from abortion, it would fall here. If there was a harm from abortion, it would fall here. This is a no-brainer, guys. She broke it out based on the outcome looked at. Alcohol use is the top. Here is anxiety. Here's depression. Here's substance abuse. And here's suicide. All of those clearly showing a statistically significant interaction between abortion and adverse mental health outcomes. Then, this is the last, but very interesting. She looked at the comparison group. This is if you compare abortion to women who deliver. This is if you compare abortion to women who had no abortion, okay? And this down here is if you compare women who had an abortion to those who carried an unintended pregnancy to term. Again, this is a no-brainer. The women who have abortion do worse. The results revealed that women who aborted experienced an 82% increase risk for mental health problems, and that 10% of the overall incidence of mental health problems was shown to be directly attributable to the abortion. The strongest effects were observed when women who aborted were compared with women who carried to term, and when the outcome measures related to substance abuse and suicide. Thank you.
Good afternoon. I am Terry Ensley, and I think I'm going to sit down, so I hope you can see me. If those of you in the back want to stand rather than me standing, you're welcome to do that. I'm a Christian counselor. I work for a wonderful agency called Cross Connections. And in May, I'm going to celebrate 15 years of working with children and adolescents and adults in my ministry. I'm also very thankful to God for allowing me to work with so many people over the years, and each one has affected me in some way. But probably no one has affected me as deeply as those who struggle with the pain of abortion. My information that I give you is mostly from my experience. I'm going to tell you some things that I think can be generalized, and I'm going to ask Lisa to help me maybe throughout this so that she can either collaborate what I'm saying or add some things of her own as we maybe talk the next 15 minutes or so on the emotional effects of both pre-abortion and post-abortion. So that just gives you a little bit of an idea of where I'm going. The first time I recall personally hearing anything about abortion was when it was not in the 1960s when I was a teen. So if you want to do the math, that means I'm in my 60s now. And there'd always been a kind of a secret that my family held on to about my great aunt Jean, who I had never met. I guess when I was a teenager, my mother thought it was appropriate to tell me at that time this big family secret, and she told me in kind of hushed whispers that Aunt Jean, who I don't know if I said, but I had never met, she had died in the 1920s, I believe, but she had gotten pregnant as a young woman and had sought an abortion, which was completed, but she had also hemorrhaged to death and had died there, I believe, where the abortion had taken place. It was a secret story, a skeleton in our closet, so to speak. And my mom didn't elaborate, and I don't think I really understood, thought, or talked about it much more after that. But as I grew older, I began to wonder about this woman who was my aunt. She was my grandma's beloved older sister. I did know that. I wondered, why did she choose to have an abortion? What kind of thoughts, or what kind of, thoughts or feelings drove her decision? Where did she find a person to perform that? I wouldn't know where to go in those days, I don't believe, but she found someone who, if anyone, was with her when she died. That really bothers me as I think about the process of death. And when, if ever, did those who loved her deal with her death or the death of her little baby? I won't have the answers to most of those questions in this lifetime, but one of the answers seems kind of clear to me, and I think it can be generalized to people who have abortions, is that it was probably fear that drove her decision, some sort of fear, and most likely it was fear of loss. She may have feared loss of reputation, loss of the approval of her family, loss of maybe the child's father. She may have felt that she would lose, fearful of losing life's goals, loss of respect, loss of job, loss of income, and maybe even loss of the hope of having a husband and being able to raise a child in a two-parent household, which was really the norm in those days. What she probably did not fear at that time was any repercussions from the abortion, either physically or emotionally, and yet that's exactly what happened. Because of the abortion, she actually lost her life. Now, I've worked with women over the years who have had abortion, and I believe that fear is a common motivation for abortion, fear of some sort of loss. Now, let me tell you another story. At least a decade ago, around 10 years ago, I was talking to a man who was a client at the time, and he was facing current struggles but didn't feel a need at that time to talk about anything that had happened in the past. Until the day he said out of the blue, and I'm sure he'd been preparing for this, but I hadn't known it, he said, "I have a baby in heaven." In 1965, I pressured my college girlfriend to have an abortion, and we broke up soon afterwards. I have never told anyone about this, never, never. I've asked God for forgiveness, but I still think about it all the time, and I feel so guilty, big word, guilty. I was just a kid. I was afraid. She was afraid. We were afraid to be parents. We were afraid to tell our parents. We were afraid that we would have to drop out of school. We were afraid that people would judge us. And now I'm still afraid. I'm afraid that my wife will find out. I'm afraid that my children will find out. And I'm not sure that our relationships will survive. And as we continued to work together, we found out that his current struggles were, in part at least, a result of his past decisions. It's not really possible to separate the past and the present so clearly, I don't think. I've worked with a few men over the years, and I've found that, like women, fear is a common motivation for abortion, just as it is for women. Fear and fear of loss. Now, if you're trying to figure out who any of these folks are, don't worry about it. I've changed details, and I've sometimes changed names because I respect the confidentiality of my clients. Still, I think in their stories, they have something to share. So I just want to assure you that if you are or have ever been a client of mine, you won't hear me talking about your story in a group of people in a way that's recognizable. I have one more story, and this one happened just a couple of years ago. So it's a more current story, and it's about an unmarried professional woman in her 30s. I had been working with her for a few months, and I thought she was very honest with me, and she was about many things, but she didn't tell me she was pregnant. Sometime during the time we had worked together, she had conceived a child, and she told me after the abortion what she had decided to do. Fear, again, had driven this decision. Her primary fear was that both she and her child would be rejected by her family. You see, she was an African-American woman, and the father was Caucasian, and her family, she knew, because she had lived with them all her life, that they weren't tolerant of biracial relationships, and she couldn't bear the thought of being rejected by her family, and nor could she bear the thought that her child would suffer that rejection as she assumed it would all through his life. So fear is a strong force that can push people to do things that are really against their beliefs, their character, maybe even what they would advise others to do. And often people believe that if the object of fear is destroyed, in this case the child, by having an abortion, that life can return to normal. That's not so, is it? Whenever we act against our own conscience, we invite more emotional problems that vary from person to person, emotional problems that can last for years or remain buried for a long time and then pop up unexpectedly, emotional problems that change the way we function and affect our worldview. When we apply these sorts of issues to abortion, it's sometimes called post-abortion syndrome, which occurs after an abortion and can be experienced by men or women. The symptoms of post-abortion syndrome are similar to post-traumatic stress disorder, which we see in incidents of rape sometimes, or sexual abuse, or we see from people who have experienced a trauma. We hear about it often when we're talking about our veterans of war. While the feelings and thoughts are not the same for everyone is changed by abortion. One woman said it like this: I came to the clinic through the front door, and I left through the back door a different person. I'm going to read to you what some of the symptoms of abortion, post-abortion syndrome are. And I would, what I've read is that experiencing 5 to 7 of these symptoms would indicate that a person who has had an abortion may be suffering with that syndrome. But I say if you have one of them, that is troublesome to you, that it is important that you seek help. I'm going to just read through them, and if you have any questions about any one of them, why don't you write it down and ask now or even after this presentation is over. And would you listen to these and see if you agree? Okay, the symptoms are guilt, numbness, emotional withdrawal, anxiety, depression, hopelessness which may include thoughts or intentions of suicide, avoiding your feelings through use of alcohol or drugs, sleep problems such as nightmares, too much sleep or not enough sleep, eating disorders such as bulimia, anorexia, or overeating, concerns over fertility or childbearing issues, loss of interest in sex or sexual promiscuity, easily irritated, inability to concentrate, avoidance of baby reminders like women who are pregnant, baby showers, baby stores, children's birthdays, anger at women with new babies. Number 15 is the need to avoid powerlessness by taking control or trying to take control. Grief over the death of the child that is kept inside. There's no shared grief, which is really called mourning. And if you don't share your grief, it's been shown that it could lead to complicated long-term grieving, which you never recover from. Overprotection of living children, strained relationships with living children, preoccupation with becoming pregnant again, either wanting to conceive right away or not feeling that you want to have children at all. Sometimes that's because of guilt, I think. Resentment or anger toward those who were involved in the abortion decision, including anger or disgust at self, and an increase in symptoms around the time of the anniversary of the abortion or the due date of the child. And for men and women who are Christian, they might experience additional symptoms like this: crisis of faith, anger at God, inability or unwillingness to forgive those blamed for the decision to abort, unsure of or unaccepting of God's forgiveness, fear of God's judgment, unsure of their own salvation or their child's salvation, and concerned about the aborted child's feelings toward the parent. I've heard so much, is she mad at me? Does she hate me? Does she know I'm her mother? Those are questions that come up. I have one more symptom I'll add, and I'll give you a recent example. Just a couple months ago, I was talking to a female client when she said, "You know, I've had an abortion, don't you? It was a little girl." I replied, "You've never told me about your baby girl. How would I know?" And she said, "Oh, I thought you probably could tell." So I thought about it, and I thought this is a symptom that I don't know how many women share, but it's kind of a perceived transparency. And in this case, she believed that people would know about her abortion just by looking at her or talking to her. It was like the guilt or the pain or the fear is something she wore on her face. Kind of like wearing that letter A around your neck in the scarlet letter, only this time the A is for abortion rather than adultery. Let me ask you, do you agree with that? Do you have anything you would want to add?
I am going to try to talk into this. I totally agree with that. Can you hear me with or without this microphone? It is a little awkward down there. My experience has been with not just personal experience with abortion, but also from working at a Hope Center, doing post-abortion ministry for about 13 years or more. I've kind of lost count. I've lost count of how many abortion stories I've heard, literally hundreds of abortion stories, not only from my personal experience, but the experience from the rest of our staff and volunteers who hear these stories repeatedly. So I agree completely with those. It's for many women, what we try to do is look at life before the abortion and life after the abortion, to try to see if that's the delineation in their difficulty. And many women can point to that specific event as being a watershed experience for them in terms of bringing about more pain into their life. This is not to say that there wasn't any kind of difficulty or pain before the abortion. Many times the reason women end up choosing abortion is because they're in some adverse relationships, some difficulties. And so I totally agree with that. One thing I would add that we see very commonly with women who are very newly post-abortive is something that psychologists call approach avoidance conflict, which is when someone desperately wants to deal with something and approaches that subject, and it kind of almost pops open like this unwanted Pandora's box, and then it closes again. And this happens over and over and over at a Hope Center, where a volunteer will say, oh, she really wants to talk about her abortion. She's deeply wounded by it. She's just cried and poured her heart out to me, and she wants to have some communication with you as the post-abortion recovery coordinator. And so I call her, and she hangs up on me. Or I call her, and she says, yeah, I'll meet with you, and then she never follows through. And that's because the box is shut. And the topic is dealt with, it's suppressed again. And I would say that largely the sum of all of these things that Terry has talked about would be summarized very well in saying it can induce, it doesn't for all women, but it certainly can induce very complicated, suppressed, prolonged grief.
Thank you. I'd like to read to you and talk to you just a little bit about what I think is needed through my experiences on when someone comes to counseling in order to facilitate healing. And when you or someone you know would go to counseling, what are we looking for? What do we want to happen? And these are the ones that I've come up with through my experience again. The chance to tell your story completely without fear of judgment. This honors your unique experience. Tell it as many times as is needed, and add details until you're satisfied that at least one other person has really, really heard you. You need the chance to mourn. You've been grieving internally. Now you need to share your grief and mourn your loss. This validates your baby's death and aids in your own healing. You need the chance to understand and address each of the symptoms that you're experiencing, those that we listed earlier and any others that are not on the list. You need to be able to understand God's love for you and for your baby. In the Bible, in Romans, God's word says that nothing can separate you from his love. You need the chance to accept God's forgiveness. That's why Jesus died for you. God promises to forgive everything except unbelief, and he always keeps his promises. You need the chance to consider forgiveness of others. This is an involved process and can take a long time, but by forgiving, you will no longer feel the heaviness in your heart. You need the chance to become assertive in your communication, which will enable you to confront others in a way that respects them and you. Once you learn this, you can decide if there are people in your life that you want to talk to about your abortion. You need to know that God was with your baby when she died and has taken care of your child ever since. She's now at peace. You need to learn how not to fear judgment or punishment from God. When God forgives, he also forgets the sin. If you believe in Jesus as your Savior, you will join him in heaven someday, no doubt. You need the chance to know that you really are a mom, that your child was living and real, and you can honor his life by giving him a name. You can honor his death with a meaningful tribute or a memorial service, and it can be as private or as public as you wish. You get to decide. You need the chance to give up fear and trust that you can do hard things with the help of God and other people. And you need the chance to do this on your own timetable and without pressure. You might have felt pressured to have an abortion. You might have felt a loss of control at that time. You should feel no pressure in counseling and should be encouraged to practice self-determination in your personal journey. And you need the chance to ask as many questions as you want about you, about your baby, about God, about your symptoms. A competent counselor will draw out these questions and help you find the answers that you seek. And now for the rest of the stories. The man who pressured his college sweetheart to get an abortion, and we talked a long time that day, and I feel like that day was the beginning of healing for him. The woman in her 30s who aborted her biracial baby continued in counseling for at least another year. She joined a support group with other women who had had abortions, and one of the women felt led to get her a charm with the child's name on it and put it on a necklace. And I always thought that gesture seemed to mark a positive turning point in her life. The woman who thought others could not see that she had an abortion is still in the early stages of healing, and I look forward to the day when she will truly experience God's love and grace in her life and will be able to respond with love and grace from others. And until then, and for as long as is needed, she will walk the road to recovery, where at the end, her perceived transparency will turn around and will reveal a free, forgiven, and beloved child of God. Thank you. Do you have anything to add? I kind of rushed through that, so you might not have heard.
Well, I think we might be to a point where we need to open up to questions, I think.
Yeah.
So I don't want to take time from that.
If you have questions, you can just pass them to us.
I should do that.
Should I just go?
Yeah, just go
Okay.
ahead and do it.
This question says, how can a post-abortive woman find resources in Fort Wayne? There are many competent counselors. Many have spiritual backgrounds, Christian counselors, and they are able to help. Terry is one that we do refer to. We see women for post-abortion support group Bible studies at a Hope Center, and we run about 2 or 3 Bible studies a year. And when we get into a situation, with my background in psychiatric nursing, when I get into a situation where I'm not sure that I can handle the situation, maybe she's too suicidal or she's abusing substances or something like that, we don't go beyond our perspectives of our competency to help in a support group, and we always refer for help with a professional counselor.
The question, I have 2 questions. How do you find yourself received by other OB-GYNs as far as your pro-life beliefs? OB-GYNs are just human beings, and they fall into the same bell curve as everyone else. There's about 5% that are adamantly pro-abortion. There are about 5% that are adamantly pro-life, and the rest fall into the mushy middle where they really don't want to deal with the issue. So if you look at who actually performs abortions in the United States, very few of them are performed by OB-GYNs. The majority are performed by family practice doctors or doctors who are not OB-GYNs. They may be general practitioners. And a huge percent are actually performed by nurse practitioners or mid-level providers, because medical abortion is becoming increasingly prominent, and it's easier. You don't have to have any technical expertise, and if you have a problem, if a patient has a problem after a medical abortion, they're simply told to go to the emergency room. So I think in order to answer that question, you'd have to look at how many OB-GYNs actually do abortions. And what I've found in interacting with OB-GYNs is that most of them will walk by the booth at the medical conference, and then they'll turn around and they'll go, you know, good, hang in there. But they don't want to say it in front of anybody else because it's politically very incorrect. Do organizations like Komen acknowledge the link between abortion and breast cancer? Most organizations, and I don't know Komen specifically, but I can say that like the American Medical Association or the American College of OB-GYN or Those are political organizations, so they are going to do what's politically expedient, and so they would have no reason to acknowledge the connection because there's no political benefit to acknowledging the connection at this point. Money drives a lot of the political correctness. Please discuss whether Plan B and Ella are abortions. And please discuss any research on relationship of birth control pills and breast cancer. Okay, let me take the bottom one first. There is some research coming out that show that women who have been on combined oral contraceptives in their teenage years for greater than 5 years have an increased risk of breast cancer. So there is some research that shows that. That risk decreases the longer they're off the birth control pill, and of course, if they have an intervening term pregnancy. Plan B and Ella are abortion. Ella, there's no question that regardless of whether you look at immediately after fertilization or during the time when the baby implants or after the baby has implanted, Ella can disrupt every single one of those processes. So Ella, 100%, there's no question, Ella works after fertilization. Okay. Plan B. Plan B is a very interesting thing. Plan B only works 4 days out of the month, and that is if you take it the 4 days prior to releasing an egg. If you take it the 4 days prior to releasing an egg, there are some studies that show it has 75, maybe 80% effectiveness, some studies that show 50% effectiveness. If you look at women's level of the hormone that's needed to support the pregnancy, that is progesterone, in women who take Plan B before they release an egg, their level of progesterone afterward is much lower. And that progesterone is essential for the baby to implant and for the implanted baby to grow. So Plan B taken before releasing an egg disrupts the ovary's production of progesterone after releasing an egg, after fertilization. Now, what happens if you take Plan B after releasing an egg? Absolutely nothing. It doesn't do anything. It doesn't disrupt the ovary producing progesterone. It doesn't seem to interfere afterwards. So Plan B is not very effective, and that's why you will see Ella replace Plan B within the next few years. And Ella is very effective, and it's very clear that Ella works after fertilization to kill an embryo. The reason I don't answer the question, is it an abortion, is because it depends on the definition of is. The American College of OB-GYN says pregnancy doesn't start until after implantation, so everything that happens after fertilization but before implantation is not a pregnancy. An abortion is the termination of a pregnancy, and therefore it's not an abortion. It's a semantic gymnastics that we go through to avoid the issue of whether or not these drugs kill embryos.
This question says, if a woman never wants to have kids, does abortion still affect her? Well, I would say, first of all, that most of you probably know just from life experience that all people go through a generation of feelings about whether they want to have children, whether they want to be in this career or that career, whether they want to be married, whether they don't. So the objective of a woman who does not want to have children may change from when she is in the highest risk years of having an abortion, which are in her late teens and early 20s. So that is probably not a completely answerable question in terms of a universal answer. However, I can tell you from my own experience, I did not want to have children when I was in my late teens. My abortion was when I was 18. I am now 48, so it's been 30 years. I did not want to have children, but once I got married and then started to experiment with the idea about having a baby, then couldn't have children, then went 4.5 years with infertility. At that point, I desperately wanted children. I also have another friend who, I seem to draw post-abortive people to talk to me, but I have a friend who had 4 abortions and said she never wanted to have children. And she would say that she told me specifically that abortion had affected her, even though she would would say that she is pro-choice. She said, I don't know how anybody, this is verbatim what she said to me, I don't know how anybody could say abortion doesn't affect women, because it does. And she told me this as a pro-choice person.
This question is, have heard from extended family members of women who have had an abortion, and are they affected by abortion? Yes, they can be. They don't always know about it. I guess I can maybe speak as a grandparent to that, since I've been speaking out of my own experiences. My children have not participated in abortions that I'm aware of, but my daughter did miscarry, and that affected me. I affected by the loss of those twin children, affected by the hope that of their watching their growing up years that I would not have, and watching her grieve is always hurtful for a mom. I'm not saying it is the same, but I would guess that there are some similarities in grief and loss of the hope and the future of being able to experience a life that includes that child.
Take that next question. This one? Yeah. Do you okay, if you want to, but I'd be glad to answer that too.
Yeah, go ahead.
Okay. The question is, why aren't we asking why your aunt couldn't get adequate medical care, basically, so that she would live? Why are we taking away safe medical procedures? Well, I guess the question is, who is abortion safe for? It's safe for the physician. It is not safe for the unborn child. And it is not safe for the woman, because remember, when we think of safe, we think of the word without risk. Abortion is not without risk. And in fact, if you look at the World Health Organization definition of safe abortion, it is abortion that is performed according to legal requirements. It has nothing to do with medicine. It is a legal issue. So when you hear this term safe abortion, what they're really saying is abortions in countries where abortion is legal. And unsafe abortion is abortion in countries where abortion is illegal. And so this issue of safe, I would challenge you to think real carefully about who abortion is actually safe for, because it's not safe for the woman, and it's certainly not safe for the unborn child. Oops. Go ahead. I'll get that.
I really wanted to piggyback on that, because Terry had mentioned her Aunt Jean who died. We don't really know if that abortion, you don't know if that abortion took place legally or illegally, but abortion was legal before 1973 in some states. I personally spoke with a woman who, when I was working on a geropsych unit, who had an abortion legally in New York in the 20s or 30s. She wasn't able to define exactly when she had that abortion. But I sat down to do her nursing assessment, which is what we do when somebody comes into the psych unit. And I did her assessment, and just immediately as I began to ask her questions, she said to me, I can tell you exactly, this is completely unprompted by me. I don't talk about these things in those professional settings, because it's not something that's even on the assessment for that matter. She said, I can tell you exactly when my problem started. It started in 1928. I can't remember the exact date, but when my dad took me to New York to have an abortion, and after that I decided that I couldn't live anymore. She made several suicide attempts, and actually was hospitalized several times for a long period of time in a state mental health institution when they used to keep people for a long time. So I would say that we don't really know whether abortion, legal or illegal abortion, is the cause for your Aunt Jean, and it can be. It definitely has impacted women both legally and if it's legal or illegal.
This question is, do women who believe that abortion was the right decision still experience the emotional and mental effects of abortion? That's hard for me to answer because the people that I see that talk to me about abortion are experiencing those things. So I see maybe not a large bunch of people who have different opinions about abortion. My personal opinion, for what it's worth, is that people's brains, people's ability to stuff things is very, very good. And I would guess that if they're having, I personally don't know how they couldn't, but I don't know that for sure. But you can stuff things and not deal with it. And I would be concerned about someone who says it doesn't affect them, that they're just not willing to talk about it and deal with the effects of the abortion. If abortion is so widely accepted as a women's right, why are women and men afraid to share? Again, I think it has to do with, because it is such a controversial subject, they don't know if they're sharing, who they're sharing with, if who they're sharing with is a safe person that will accept their story and will help them to deal with the abortion. I don't know. You probably know the answer to that as well as I, and if I ask you to discuss it, you'd probably have lots of really good reasons why that doesn't happen.
Another reason why this happens, I have spoken literally with hundreds and hundreds of women who are post-abortive, and what I have heard repeatedly is that I made that decision, and when you make a decision, especially a decision that could be as life-changing as abortion, your desire is to justify or to satisfy that decision afterwards. And so they chose that, and I chose that. And there certainly wasn't a sense that I or for many of these women I've spoken with, that there's any reason, anybody who would listen, because they chose it. And they feel like they've sort of invited this thing into their life, this pain into their life, and so they just kind of carry that for many years. I cannot tell you how many times a woman has told me, I will go to the grave with this in my background. And then, of course, as Terry said, it was very well put, that it surfaces up, it bubbles up because of other life stressors. It just can't be something that they continue to suppress.